Researching psychological disorders for this assignment, I have come across a lot of new disorders that I did not know were real or that even existed. One of which is mirror touch synesthesia. It is the person affected is physically mirroring pain or sadness or mild sensations that another person is feeling. If the person affected with MTS is feeling it on their left, then they feel it on their right. It's as if you're looking in the mirror. You're reflecting in your body how another person is feeling. The symptoms can vary with a mild sensation, like maybe a paper cut, or it could be a very severe pain, like a migraine, a heart attack, sometimes even seizures. This disorder is not curable because it's a part of who the person is. It mimics with empathy. When a person is feeling sad, you understand that that person is feeling sad. You understand why they're feeling sad. But someone with mirror touch synesthesia will physically feel as sad as this other person, may even cry with them and feel the exact same emotion. And there are treatment options. You can get an anti-anxiety medication, an antidepressant from your doctor, or there are even therapy regimens that you can do. One is imagining that there is a barrier or you are in a bubble. What this does is it helps your mind to block out those high levels of emotion to where you're more of relating to that person instead of physically feeling how they're feeling in that moment. With psychology, you have nature and nurture. Mirror touch synesthesia falls under the nurture because it's not something that you are taught in school or taught by your parents. It's something that you're born with because you have such high levels of empathy. You feel how other people feel. And a way to diagnose this is hard, but not impossible. The person that are feeling these large amounts of emotions, they go into their doctor. You need to be as specific as possible. Tell them that you feel everything. Specific examples that you went to your mom's house and she had a rash on her arm and it was burning, and you felt the same rash and burning sensation on the opposite arm. A way for doctors to do this is having their patients watch videos. The patient will watch a video of someone crying because they're sad or they're having a heart attack and they're feeling that pain. They will watch their patient to see if they feel that exact amount of pain. They start crying. They start holding their chest because the pain is unbearable. And it takes time to diagnose because it is so rare. It is almost impossible to understand that a person can physically feel the same level of emotion that another person is experiencing. A few articles that I did read, there are doctors who have mirror touch synesthesia, and they are sent to talk to patients who have health concerns that are hard to find on tests like EKGs, EEGs, MRIs, CAT scans. If their symptoms don't match up with what they're finding on these tests, then the doctor will go talk to the patient. Have the patient explain their symptoms to them, their pain levels, where at in their body they're feeling it, and the doctor talking to the patient. If the patient is feeling all of the pain in their left side, wherever in their body, the doctor will then feel that same pain and same levels in their right side. So the doctor can go talk to the attending or whoever's treating that patient, can say, this is what I'm feeling on my right side, which means that this person is feeling the same thing on the left, and these are the labs to run the tests. This is what I believe is going on. And it has greatly affected and helped treat these patients to find out exactly what is going on. And with psychology, it's a great tool for the healthcare field because it opens your mind to different aspects of how people work. It allows you to learn these different disorders and get an idea of how these people are feeling, so that way you can better understand how they're feeling and how you can relate to them and empathize and, talk with them. Bipolar disorder and anxiety, they need a calming approach. So if you know that your patient is suffering from anxiety or bipolar disorder, you know how to confront them. And psychology allows you to understand the symptoms and the treatment options and how to go about helping this patient because you know what is going on. You can, work your way around their disorder to treat them for whatever is affecting them without adding extra stressors to that patient. And with the healthcare field, the number one goal is to treat your patient, to understand them and build a relationship with them. So that way they feel like they're understood. They feel that they're going to be treated and they can trust you, that you're not just pushing their symptoms away to get another paycheck, to just push them out the door. You want to treat them. You want them to know that you're there and that you care. And psychology allows people to do that because it explains the different disorders that people go through all the time. Even though you don't physically have that disorder, learning about it allows you to understand just a little bit of what they're going through. And that is a great thing with working in the healthcare field, is helping other people. And psychology allows you to do that by helping. Learning about the mirror touch synesthesia was eye-opening because that is one of many rare psychological disorders that people go through. They may not be able to relate to other people or talk about it because they know that their levels of empathy are much higher than most people, and the people will not understand how high their levels are and how much they really do understand. So with the medications that brings down those emotions, they can better handle it, and it's not overpowering or overbearing, and they can function normally. With mirror touch synesthesia, because you experience all of these emotions, it can be hard to watch TV because even watching characters go through pain, you feel that as well. And having so much emotion in a person can be tiring, that you just want to block it all out. You don't want to feel. And with life, that can be hard to live because you can't go to the grocery store, because if you look at somebody who's having a migraine, you're going to get that and you can't function and finish what you're doing. So having the medication from the doctor or even the therapy techniques that prove beneficial are good to have and good to use. I was surprised to learn that the mirror touch synesthesia was a real thing. I did not know that the empathy emotion could run as high as it does. as an empath myself, I do relate to people, but I do not feel exactly how someone else is feeling. And the way the mind works is amazing. That it can allow you to physically mirror someone else's emotions without them being your own. And by using the psychology and by using and learning all these different things will help in the career field that I've chosen because I love helping people. It's who I am. So by learning different things in psychology, that gives me a better idea of how I'm going to help everyone that I encounter in the future to better understand them and to put their worry at ease because they will know that I am there to help them and that I do understand. And with my knowledge, I will help them overcome whatever it is that they're going through so that way they can live peacefully with their lives.